My name is Joel Kaviyakone. I work at Nationwide Children's Hospital in Interventional Radiology. My day starts at 7:30 for me. I'll walk in, get changed into my scrubs, checking out the daily schedule, see what room I'm working in for the day, and then getting the first case kind of set up to get rolling. This is our lead. Everyone has a different pattern, so honestly, depending on where you're at, they will get you fitted for it. So this one I got fitted for when I started working here, and I got to choose the dinosaurs, so it was great. It was a lot of fun. Home base is down here, and then there's a big table back behind me with all my equipment and everything back here. But typically I'll stand here with controls, and then the doctor's like up this way. This is our biplane, and both of these things will move. We usually utilize our biplane for our neurointerventional cases, and then usually we'll bring this in closer to the patient just so we can reduce our scatter radiation. I did not expect myself to be working in healthcare at all. I felt like I had a passion to help people in that sense, which I had no idea, and that just kept growing and growing. I started working at an adult facility as a patient transporter, and that's when I got to see a lot of the hospital and a lot of the care that people were providing for the patients. And I came along radiology, and that's when I was like, okay, I think this might be what I want to do. Let me figure out more about that. And I did, and wound up finding out what X-ray school was. That program in itself is a 2-year program. There's so many different things that you could get into within radiology that you really don't see until you're like in it, if that makes sense. I feel like a lot of people think the normal X-rays of like broken arms, broken legs, chest X-rays, all that stuff, which we do, but there's this whole other world that was like everything, like crazy procedures that is very minimally invasive. I had no idea that this was part of radiology. I'm a very super hands-on person, and in interventional radiology, you kind of are the second set of hands with the doctor. I liked the idea of being able to help fix issues. It's something that like fills my cup, seeing patients come out on the other side in a much better shape than when they came to us.